Afternoon, everyone. We've just started to admit everybody, so hopefully this will be filling up very shortly. We're really excited to welcome you all. We've had such a large number of people, over 200 have signed up for this session, so hopefully everyone can squeeze in. It's a good job that we're in a virtual space, not a physical one, that's for sure. We've got a really big variety of vets, nurses, practice staff, people working across different species and specialisms, all represented here. So we're really glad to hear from you all, and hopefully we can have a great discussion this afternoon. I will just introduce myself. I'm Ing Harrod and I am Director for Advancement of the Professions at the RCVS, and I am very delighted to welcome some great speakers here today. Before I get to them, I'm just going to start with a few bits of housekeeping as we welcome a few more people with us. So we are going to get Slido up and running. Hopefully most of you are familiar with Slido. If you're not, then all of the instructions will be hopefully very clear. As you can see, there is a number on the side, and you can join in. What we would love to do first is ask you about your feelings of working in veterinary or animal health. We're considering that there are a lot of people who might not work clinically, but you might be in very different roles. So we would really enjoy hearing from you about what you find the most satisfying. But then also we're going to ask you about the workforce ambitions and which ones of these are the most important to you. So you can pick the options, but just be mindful there are 7. So have a good look through and think about what might be the most meaningful to you. Now, in terms of housekeeping, as those of you who have joined us from the start, I said we had over 200 people who've signed up, so we had a lot of questions that were submitted in advance, which has meant that we've had to try and group the questions and theme them so that we can get through as many as possible. What we have tried to do is make sure that these have already been woven into the format of the event. Vicky, who is going to be presenting shortly, we've put some to her about the workforce modelling, but then we've also got others that come through. There were some really great specific questions, so great that what we've decided to do is put them forward into other sessions on the specific ambitions. So things like the client communication challenge questions, vet nursing and schedule 3, return to work. We are going to put those to our experts in the next couple of sessions. So your questions will be answered just in a variety of different formats, and hopefully this will mean that we get through a lot more. Now, on the subject of a lot more, the last time we did these, when we first launched the ambitions, we had feedback saying that 60 minutes wasn't enough. We needed more time for Q&A and for general chat. So we've extended this session to 90 minutes. So hopefully that will be enough. If we still run out of time at that point, we will consider that that's been a success. And if we finish a little bit earlier, then you will get that time back to yourself. We won't just keep going just because we've said that we'll do it in 90 minutes. We will make sure that we use this time effectively. Everybody is very busy, so we are appreciating that you're sharing your time with us. What we are going to do is Vicky is going to present the workforce modelling, and then we'll have a brief Q&A related purely to that. And then we'll go into question time with Linda and Sue with the pre-submitted question themes, and then having general questions at the end of that. So it's great to see the Slido is being populated. If you've just joined us, make sure that you take a moment to contribute to that. We are recording this session so that people can either watch it back if they've not made it today, or if they didn't sign up for it, then they will be able to get to it. So if you can keep your cameras on, then we'd love to see you. It's always nice to talk to real people. But if you could remain muted so that we can hear the speakers, that would be super. If you want to ask any questions, then please use the Zoom chat. That will come through to us. But equally, if you want to pop anything in the chat, then please feel free to share anything that way about resources or where you're from, those sorts of things. We love to hear from people. We will be putting resources into the chat as the topics are discussed. So these will be links to, this might be documents, it might be content that we have, academy courses, etc. So do keep an eye in the chat for things where we can actually show you what we've been doing. So I'm now going to try and take a look at your answers for what do you love about working in the veterinary sector. And this is really really great to see. So working with people seems to be one of the most popular, especially talking about the team, helping others, thinking about potentially the patients as an extension of that team. There's lots in here about having that challenge, and helping and improving animal welfare. So this is all really positive stuff, and not all of it is purely clinical. I can see that these answers might have come from people that that work in all sorts of different organisations. So that is a really positive start to this, and hopefully this has given you a moment to reflect on the impact that you have, whatever your role is within veterinary or animal health. Deb, are we able to take a look at the ambitions now, just to see what people have said? So this is the next question. So if you're able to tell us which of these is the most important, then that will give us a little bit of a hint as to where you're all coming from, and then we'll head over into Vicky's talk. So please feel free to populate this. Oh, this is starting to move quite significantly now. You've got three options, so there's plenty of opportunity here to have your voice being heard. I think this is going to move all over. But confidence, culture, and recognition, that seems to be staying at the top for the while, which is good, because we are going to be talking about culture for quite a considerable part of this. So I'll let you finish writing that up, and I'm going to introduce Vicky. So Vicky Bolton is our research manager who joined us at the college last year, and we are very grateful to have her with us as part of our organisation, because she's able to answer some really tricky questions and do some very clever modelling and give us lots of insight as to where we should be going next with some of our research, and supporting us in how we do that. So Vicky, we're going to hand over to you so that you can share with us the overview of the workforce modelling and the data and what it may or may not tell us. As I said, we've woven some of the pre-submitted questions. We've shared those with Vicky, so hopefully you'll hear some of your questions being picked up in that. But we will have a brief time at the end for asking a few questions about this. So Vicky, I'm going to hand over to you, and we will be in your hands.
Thanks so much, Angharad. Hopefully you can now see my screen. Excellent. So nice to see so many people here. As Angharad said, I've been at RCVS for not quite a year. I joined last summer. Before I arrived, I worked for a really big market research company doing really large scale government surveys, and before that I was at University of Southampton looking at a cancer cohort. So I've got quite a varied research experience, and it's been a lot of fun to come and learn about you all and your profession. Today I'm going to talk about the data that we have access to as the college and as a profession. And I'm going to talk a bit about how we can understand that data and how it can help us understand some of the claims that we often hear about the veterinary workforce. I'm going to show you the bathtub full of vets, or indeed nurses, for those of you who are nurses. And I'm going to talk a bit about the fantastic modelling that the Institute for Employment Studies did for us. I mean, as I said, I've only been here for just under a year, so I really feel as though I've been goal hanging on this one. It's a very cool model that we published at the end of last year, and I'm going to show you some of the data and projections from that. So what do we know and what don't we know? The data that you can see on the slide, that figure for 30,632 UK practicing vets, that's the register data, and it's actually last week's register data. I think there are 2 additional UK practicing vets if you check it today. And similarly, 25,120 registered veterinary nurses, pretty sure that's now 25,123. So the numbers fluctuate ever so slightly week by week. It goes on an annual cycle. So there are more of you as new graduates come on board over the summer and fewer as people drop off in renewal season. So we have what an economist would call perfect supply data. Every veterinary surgeon and nurse is registered, so we know exactly how many veterinary surgeons and nurses are supplied to the veterinary sector. Register has really fantastic information. It's great on gender, but there are pretty decent sized gaps in our data on ethnicity and species specialism. And there's no information at all in the register on your plans and attitudes. No information about your working hours. No information about qualified vets and nurses who aren't registered, so people who could be but aren't. So we know that vets are 67% female and nurses 97%, and we know about the growth rate. 4% growth in vets per year, 7% growth in nurses per year. But what we don't know is about the people who are not on the register. However, we know things about people who used to be on the register, people who depart. So on the slide, you can see the figures for 2024 for the vets who left the RCVS register altogether or left the UK practicing category. So these numbers are out of about 30,000. And you can see that the biggest categories are those leaving the category UK practicing rather than leaving the register altogether. And of those leaving the category UK practicing, the biggest group have moved to practice outside the UK. And this matches the information from our 2022 paper, Recruitment, Retention and Return, which had 41% of those voluntarily removing or changing category, 41% were going overseas. And that's actually pretty much the same percentage that you can see here. 11% were retiring, 9% on a career break, 9% heading off on maternity or paternity leave. And who are we kidding? This is basically maternity leave. And only 2% were leaving the industry permanently. So when we talk about the RCVS register figures and we talk about people leaving, usually we're talking about people leaving a category and not people who are leaving the profession altogether. Yeah, that was some highlighting I could have done with about 4 sentences ago. Okay, so that data from the register, in fact, data from 2017 to 2023, was fed into a fantastic piece of modelling by Matt Williams at the Institute for Employment Studies. And the aims that we gave him were, please forecast the likely supply of vets and vet nurses. And he used trends in retirements and trends in other exits. So the exits that we talked about, people moving overseas, people going on leave. And we asked him to look a decade ahead, so up to 2035. And then the really tricky bit is the analysis of the gap between the current demand and supply. And for that, he used vacancy data. and then applied an economic trend number. And so that's what I'm going to talk to you about today. Okay, I promised you a bathtub. Here's the bathtub. Welcome to your profession, a bathtub full of vets or nurses, but not both together. The model is, well, it's actually two separate models. One model for vets and one model for nurses. So sometimes I think we hear the profession talked about as a leaky bucket, but I think it's really more like a bathtub. And I'm going to explain why I think that. So a professional career starts with qualification and registration, and that's the flow into the tub. And then at the end of a career in the veterinary profession, vets and nurses retire and they flow out of the tub. And in between, they sit in the stock in the bathtub of vets or nurses, and the tub can be topped up with overseas qualifiers. Oh, could everybody make sure they're muted, please? Thank you. And so the stock of vets or nurses, it's the bulk of the profession, people getting on with their professional lives. And just like in the bucket analogy, there are leaks, but I think the bathtub puts the leaks into perspective. Leaks are relatively small in numbers compared with the size of the stock. So when we looked at the 2024 figures, we looked at a stock of 30,000 vets, and only a little over 1,000 were drifting away. So the leaks are small compared with the size of the stock. But the leaks are where we focus a lot of our attention. And I think that's why the bucket was an attractive analogy, because the leaks are really important in personal and policy terms. So nobody wants or needs to intervene when a vet or nurse joins her profession, builds her professional life, or retires once she has a big enough pension pot. Those things aren't a problem. As a profession, though, we do care about and want to intervene when people leave if they feel undervalued, or if they burn out, or because they struggle to get back in after a period of leave. So those leaks are things which are very significant in personal terms and in policy terms. And I think that's one of the reasons why some of our workforce myths have been so persistent. So there is a persistent but mistaken idea that almost half of young vets leave the profession within 5 years. And I think those things take hold because when we see somebody leaving a profession that they loved and fought to be a member of, we can imagine how much that decision to leave has cost them. And it looms large for us the way that it does for them. So this is another reason why I'm saying think about the tub more than the bucket. So by the way, that myth, half of young vets leave within 5 years, we worked out the other day where it came from. It was born from the original recruitment, retention and return paper, which kicked off this phase of the RCVS workforce programme. And so in that, I'm going to quote from it, in that paper, it says, in 2021, 45% of leavers had been in the profession for 4 years or less. So that's 45% of leavers. So that figure is telling us that nearly half of the vets who leave are young. Doesn't tell us that half of the vets who are young leave. Okay, bathtub. Who is leaving? So I said that there's a persistent myth. This is going to help us dig into what's actually happening. And it's true. So I think at the bottom of every myth is a truth. Recent graduates are more likely to leave the UK practicing register than mid-career vets. So mid-career vets, vets in their 40s, they're the really stable group. Only 3% of them move a year, and that's not surprising. They're established in their careers, they are established in their communities, they're established in, they've probably got a family, they're established for their family's sake. So they're less likely to move in or out of the profession. And the recent grads are more likely. It's still only a 5.8% outflow. So it's much smaller than you might imagine. So on average, between 2017 and 2022, 356 vets aged under 30 left the UK practicing category each year. And of those, by far the biggest chunk was heading overseas to practice. And that's something that's evidenced both in the 2024 register data and from recruitment, retention, return in from the start of this workforce phase. I'll also put in a plug now. Look out for our exit survey results, which should be coming out in November. 2 years ago, we introduced an exit survey for all of those coming off the UK practicing register or voluntarily leaving the register altogether. And that, we hope, will give us a much more detailed insight into what people are doing and why they're moving away. By the way, we know from recruitment, retention and return that the most common destination is Australia. So if what we're looking at is young graduates using their excellent qualifications and skills to be internationally mobile and perhaps enjoy the better weather, it might not be a policy problem that we urgently need to solve. But if there's something about, for example, practice in Australia, which we could emulate here in the UK without hitching a rope around ourselves and dragging us 1,000 miles south, we'd like to know. And that's one of the reasons why we're having this series of sessions. Nurses, by the way, look quite different to the vets. Don't think I've forgotten about you, nurses. So for nurses, it's still a very young profession, both in terms of the age of the average nurse and in terms of registration. So looking at the nurses, you can see that outflow is very low and increases with age. So outflow is 4.6% of nurses age 50 plus compared to under 1% of the 18 to 24-year-olds. So nurses, as you qualify and join the profession, you tend to stay. That's what we can see in the data. And we're only, because nursing is such a young profession, we're only now coming up to a time where we can look back at a cohort which has had an entire career as RVNs. And so this is another reason why this is such good timing to do these workforce webinars. Okay, the model. So the workforce model constructed by IES uses the register data that I've been talking about, as well as some data from the survey of the professions. And Matt, the economist, divided the veterinary workforce into 252 categories. So it's a really detailed model using age, gender, ethnicity, country of nationality and residence, and that all of those categories multiplied together gives you 252. And then he moved the model on every year for 10 years. So the model is then adjusted every year for the percentage of each of those 252 categories who leave on average, for age band moves. So over 10 years, people will move up an age band. It's adjusted for new joiners. So you get new joiners in the youngest age groups as people graduate into the profession. And you also get new joiners as people are internationally mobile. And it's also adjusted by the numbers who restore. So that's people who leave the register, perhaps they go or leave the practicing category. Perhaps they go overseas, spend 2 or 3 years in Australia and then come back. Perhaps they take some caring leave and then come back. And so the model is 252 categories adjusted 4 ways over 10 years. It's very complicated. The model for nurses is slightly less complicated. For example, there's no gender split because such a high proportion of registered nurses are women. So there's just too few male nurses to make that distinction across other groups. So when I talk about the methods, I'm going to talk about the vet model because that's the complicated one. But in a moment, I'll present the results from both. And if you've got any questions about the differences, I'm really happy to take those at the end. Okay. So a couple of points to note. When the IES modelled joiners from the universities, they were measured as joiners, not graduates. So taking care not to make the mistake of assuming that every single UK graduate joins the UK profession. We know that that isn't so. The model takes into account the new universities, and it takes into account average restoration rates. So this is vets who drop off and come back from the practicing register for the years between 2017 and 2023. In terms of demand, so I said that the hard part of the model, the difficult thing to do is to model the gap between the supply, for which we have really, really good data, and the demand, for which we have less good data. So the demand data we got by asking very nicely large employers, please could you tell us about your adverts for vets and nurses and how much trouble you've had filling them. And for excellent commercial reasons, we've had difficulty getting enough information for categorization. And we're really hoping that when the major employers have seen and had a chance to digest this model, they'll be willing to share perhaps a little more information because they'll hopefully be able to see how useful it is. So we will be coming back and asking for more demand data, both for vets and for nurses from the major employers. And then once you've collected information about demand now, you have to project it forward. And this is really an economic question. So the long-term growth in demand for veterinary services has been estimated in this model at 2.5%. And it was calculated by using PDSA data, PAW data, on the growth in the number of dogs owned. But it's also a perfectly reasonable figure for economic growth. The ONS calculate the growth in vet services at about 3% a year. So it's not an outrageous figure at all. I will just take a moment to show you the PDSA PAW data though, because it's quite fun. So the data on the screen shows you the cat population between 2015 and 2024 in the heavy black dotted line at the top, the dog population in the blue smaller dotted line, and the rabbit population trailing there along the bottom. And the reason that this is such cool data is that the methodology is unchanged since 2015. So we'd expect the numbers to be broadly comparable. So PDSA also very kindly gave us some other information around preventative healthcare and well-being. They gave us detailed data about population and ownership and preventative healthcare and how they've changed over time. So I think their key finding is that there actually wasn't a significant change since the pandemic in pet population or pet ownership. And it's not the same message that we hear from members, which is that their lists are full, that they're getting inundated with client requests post-pandemic. And PDSA have speculated that perhaps that's because many of the pets purchased in COVID were by first-time owners who perhaps had different behaviour towards veterinary care and preventive medicine. So the other thing I'll say while I'm busting myths is I had a look into the data for why we all think that there was this huge boom in pet ownership in COVID when it doesn't show up in the PDSA data, which is really the best data that we have. And I think, although I'm not sure, I think it comes down to some survey data from the Pet Food Manufacturers Association. And it's actually really good data. They're asking 2,000 people. It's a perfectly sensible methodology, but their method changed during the pandemic. So they were asking face to face. It was a face-to-face survey asking about the numbers of pets. And then during the pandemic, they switched to an online methodology, and there was a big increase in their numbers, which has continued to sort of be level. So there was a jump from 9 million pre-pandemic to 12 million post-pandemic. And that was published as a huge jump during the pandemic. But I think at least some of that, if not all of it, is a methodology effect. But I mean, I'm a researcher, I probably would say that. Anyway, cool. And I love doing a bit of digging into data. So back to the model. I said that the model uses registration data, but it also uses data from the Survey of the Professions. And this is what it uses it for. It uses it to account for full-time equivalence. So the model uses data from both 2019 and 2024 to estimate what proportion of each of the groups of vets and nurses is working full-time. The projection, by the way, is that there will continue to be an increase in part-time working, but the increase will slow. And that's the same for most of the assumptions in this model, that they're made quite conservatively. And it's important when you think about a model like this to remember all of the assumptions that are sitting in the background, all of the assumptions that you have to make to get a final number. Okay, so with that warning ringing in your ears, results. The projections first for vets. So the number of vets on the register is projected to increase by 52% by 2035, reaching 44,800. So that's a growth rate of 3.5% a year, which is slightly lower than the 3.8% rate between 2017 and 2023. And taking into account a full-time equivalence, that's an increase in 42%, with the average full-time equivalence falling from 0.85 to 0.79 in 2035. Now, looking at those projected figures against demand, so what you can see here is a projection of supply as a percentage of demand. And I'm going to suggest that you start looking at this graph at the right-hand side, the clump of pretty coloured bars with total underneath. So that's the total, the whole of the profession, not broken down. And it's supply as a percentage of demand. So as the bars approach the blue line at 100, supply equals demand, and there's no shortfall and no oversupply. So if you look at that clump of bars on the right-hand side, you can see that the model is projecting that there will be an improvement in the gap between supply and demand, so that supply will more closely approach demand towards 2035 than it does right now. You can also see that if you look further over towards the left, For clinical practice, which is by far the biggest group, that's going to be even closer than for the total. And for charities, using this modelling, we'd expect to see a very small oversupply. It's important to remember that this is a mechanistic demographic model, and it's based on the 2023 vacancies projected forward. It doesn't contain any additional information. So using the data we have now, we estimate the shortfall at 2,600 full-time equivalent vets, projecting that shortfall to fall to 1,700 full-time equivalent vets in 2035. The Excel files which hold this model are very cool, and can be I can adjust them. So I can look at adjustments to the predicted in and outflows of vets and nurses. I can model a shock. What would happen if there was a sudden international policy change which pulled more graduates to Australia, for example, and I can add in future graduation years. So this is really just a step in the process. It's a very cool step, but we're going to be using this model to look in more detail and to look further ahead as time goes on. Now, I promised nurse results as well. The number of vet nurses on the register is projected to increase by 78%, a much bigger increase than for the vets between 2023 and 2035, reaching 41,200. So like I said, the growth rate will be higher, roughly 5%, so higher than for the vets, but we're projecting that it'll be a lower growth rate than it has been between 2017 and 2023. And similarly, we're predicting that there will be an increase in part-time working, but the economist, Matt, who did the study, has made the conservative assumption that the rate of increase in part-time working will slow slightly. So similar graph for the nurses. Once again, start on the right-hand side, look at the total. The line at 100 is where supply is 100% of demand, where supply equals demand. And you can see that we're projecting an oversupply. Once again, I'm going to stress it's a very mechanistic model. It doesn't tell us anything about the economic behavior of nurses or nurse employers. So it doesn't tell us how employers will react to there being more nurses available. It doesn't tell us how nurses will react to that. Once more vet nurses are qualified, more are available to work, we might expect a greater take-up of nurses among employers and potentially a change in the way that nurses are used in practices. And I will show you. So one of the reasons that I say that I can use the model to look at projections of the ratio of nurses to vets. So what you can see on the screen is the data followed by the projection of the ratio of nurses to vets. So the heavy black line in the middle is the total, but the lilac line at the top, that's charities. So you can see that right now there is a higher ratio of nurses to vets in the charity sector than in other sectors. And it's possible that that is to do with the way that some of the big charities do their work, perhaps with a safari model where you have nurses running a clinical practice room and a vet moving between them. So I've used the full-time equivalent supply figures for vets and nurses to show these ratios. And you can see that the projections suggest that there will be a higher ratio of nurses to vets in clinical practice, moving up to meet the ratio in charities right now. Again, this is a static demographic model. It doesn't tell us what's going to happen. It doesn't tell us how vets and nurses are going to react or how employers are going to react to these changes. But I think it's just one of the very cool things that we can do model and the projected data. So to conclude, I've shown you the RCVS register data and talked a bit about the survey of the professions and how it can feed into our understanding of workforce. I've talked a bit about how we can use the register data to understand the workforce claims that we hear. One of the things when I've given parts of this talk to a university, one of the things that I remind the students is always ask about your denominator. Ask about the method, ask about the denominator. Who is this figure out of? How did you get the figure? If you don't like the methodology, don't even read as far as the conclusion. I've also talked about how we've used that data to build a model of the bathtub of vets, of the flows in, the stock, the flows out, and the leaks, which are so significant to individuals, but relatively small in terms of numbers. And I've talked also a bit about next steps, what we're going to be doing with the modeling, the additional data that we're going to be requesting, and how we're going to be pushing that projection forward beyond 2035, 1 year at a time, 2036, 2037. And while I've got you, just for my final 30 seconds, although I'm pretty sure I am running over, apologies, Angharad. I'll also say that we'll be starting a cohort study next year. So a cohort study is a study which follows people through time. This follows the graduating class of 2026. The veterinary graduating class of 2026 follows them through time for 5 years to see what happens as they join their profession, to see what experiences they have and how they feel about it. And I'm really looking forward to coming back and doing a third phase of this in 5 or 6 years' time when we have the results coming in. Thank you so much for listening. If you have questions about the model or the data, I'd be really happy to take them.
Thank you, Vicky. That was really helpful. There are lots of questions in the chat, which you probably haven't seen because you've got your slides up. But there are some good ones in there. What I might suggest to stay on time is just a couple of questions. A few people have commented on the less than full-time working or how that might be a leak. I know you touched on it briefly, but would you mind just talking about the information that we do have around what veterinary work constitutes?
So the figures that we have on less than full-time working are from the survey of the professions. So this is not the perfect data of the register. This is survey data and the response rates are average. We get better response rates than some regulators and royal colleges, but not so good as others. Pretty mid-table. It's a mid-table response rate of 19% for vets and 16% for nurses. And the other difficulty with the survey of the professions is that those of you who are older are much more likely to fill it in than those of you who are younger. So please, 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 all of you who identify as younger, next time you see a survey come out, please fill it in. You are underrepresented. But because of the way the data was used, that's less important because the workforce model looked at different age groups separately. Actually, full-time working is more common among younger vets and nurses. and part-time working is more common as vets and nurses head towards retirement. So if you interpret it as a move towards retirement, you could interpret it as a leak. It's not how it's modelled here. It hasn't been modelled as a leak. And I'm sort of reluctant to think of it as one because all of the people who are working part-time are working and they're part of the veterinary workforce.
Fab. Thank you, Vicky. Want to be kind enough to respond to some of the questions in the chat, please? Because there are some
Yes.
specifics around numbers of animals registered with vets and those sorts of things. So,
Okay,
if
so
you don't mind, that would
I've
be
got
super. And then we can move on to bringing in Sue and Linda and get to some of the other questions.
So I've got, is the leaks figure 1,000 a year? Roughly. So it's roughly 1,000 change register category, and then roughly 200 removal together from the register. And then another 200 aren't voluntary removals, they stop paying. So we don't know what happens to them. They just stop talking to us. And actually, those are the people that I'd love to talk to because we have no information about them at all. We don't know whether they're retiring and have just decided not to talk to RCVS anymore. We don't know if they're burnt out and don't want to talk about their career anymore. We don't know anything about them at all. So those 200 I'd really like to know about. So it's not quite 1,000, it's more like 1,500 a year.
Lovely. Right. Well, thank you, Vicky. I am going to move us on, and then we might come
Sorry.
back to some more of those questions at the end. No. I can see this is clearly fascinating to people.
I'll do some
but
in the chat.
Would you mind? That would be super. Thank you. Lovely. Now, let me move on to introducing two of our other speakers, and I promise you there will be more time for Q&A at the end. We are very lucky to have joining us. We have Linda Belton, who is the current RCVS president and also a GP in practice in Gloucestershire. And then we also have Sue Patterson, who is a past president of RCVS and current chair for advancement at the Professions Committee, and is a dermatologist. So we've got some good insight here from different parts of the vetting world. But both Linda and Sue have been very involved in all sorts of different projects across the college. So we're very pleased to have them here with us. So we've, as I said at the beginning, we've themed the questions that all of you have submitted in advance. And what we're going to look at is looking at different career stages. So we are going to start with looking at the beginning of the journey, getting into vet school, curriculum in vet school. A couple of questions have been raised about the role of universities in educating vets and widening participation. So Sue, might you be able to just give us a bit of a flavour about people who are heading into vet school and what has changed, and also the accreditation changes that have taken place for vet schools, please?
Okay, I'll try and make sure I'm fairly brief so people actually get to leave at a decent time. So there's a huge amount being done, Garrod, and I think the first thing we have to say is that there are policies in place for the vet schools around widening participation. But the vet schools would say to you, they can't offer places to students from widening participation backgrounds if they're not having students from widening participation backgrounds actually applying. So the first step in the whole process is there's a lot of stuff going around engagement with schools. I'm delighted that college has now got an outreach and engagement officer who's made a huge difference, and she's been working with BVA and some of the really fantastic people who are part of Animal Aspirations, which for those of you who don't know are veterinary students who are spread across all the different schools, who go out in their own time to schools from widening participation backgrounds to actually talk to school children about careers in veterinary medicine. We also went to the New Scientist exhibition last year. Linda and I both went. We had a stand there. And when again, we spoke to loads and loads of people who are unaware of all sorts of things. They're unaware of the fact that there are gateway courses where people who aren't, A-star scholars can actually get into vet school by taking gateway courses. And that's something I weren't aware of. We spoke to lots of boys about the profession, because again, lots of them said, well, no, I don't want to be a vet because I want to do eye surgery or open heart surgery. And we said, well, actually, you can do that if you're a veterinary surgeon as well. And we also spoke to lots of boys again about careers in veterinary nursing, because again, there's a real misconception about what that actually involves, and people don't realize that veterinary nurses are professional people who have really useful, meaningful, rewarding jobs. They're not just people who sort of clean out kennels anymore, although we all clean out kennels from time to time. So there's a huge amount that's being done. As part of colleges' reaccreditation of new accreditation standards that came in 2023, they actually insist that all vet schools have widening participation policies. They monitor those policies. And what is also really, really important for me is they actually monitor the progression data for the vet schools. So they're not just making sure that people from widening participation backgrounds are getting entry to school. And when we're talking widening participation, we're talking people from different ethnic backgrounds. We're also talking about people from different socioeconomic backgrounds as well. So it's not just them getting in, it's making sure they get the support when they're there to make sure that they have the same opportunities to go through their course and come out the other side. So there's a massive amount of work that's being done around that as well. The other thing, again, which I hear a lot, is this misconception about the educational standards at schools. And again, a lot of people don't realise that with the new accreditation standards came in the requirement that 70% of teaching has to be in a primary care context. So our undergraduates are taught about primary care practice. They're not allowed to spend the majority of time sitting in referral hospitals looking at, very specific and specialised surgery. They have to be able to do the stuff, the bread and butter stuff that vets do when they actually go out into practice. I think probably 10 years ago, vets could identify adrenal glands more easily than they could actually identify anal glands. It's now completely the other way around. The other thing that I also hear a lot about is contextualized care, and that vet students are taught gold standard, and that is not the case, if we should ever even be using that term. They are taught contextualized care at vet school now. And one of the other stipulations from our accreditation standards is that although something like charity practice is really, really valuable, because they're getting a wide range of staff, they're giving the opportunity to practice, it doesn't involve talking about money. And so one of the things, again, that they have to do is they have to be confident in having those conversations with clients around costs and prices and actually personalising treatment plans for animals. So everything's changed enormously over the last 10 years with the new accreditation standards coming in, with the amazing amount of work that the schools are doing around widening participation. So I think it's really positive, the stuff that we're seeing coming out of our schools and the work that's being done.
Thank you, Sue. That is a whistle-stop tour, but hugely comprehensive. So hopefully that's given people a bit of an idea as to what we're now starting out with. So thinking about those people who are qualified and who are out in practice or who are working more broadly, talking about practice culture, we know that this is a topic of, it's at every conference, it's always something that's being discussed. If we start with leadership, especially thinking about the CMA and legislative reform, Linda, are you able to share with us a little bit about the latest interactions with the CMA and what this might mean, and then we can move on from there to talk more about leadership?
Okay, I think in terms of what it might mean, that is an unknown. So we have the potential remedies paper that came out at the beginning of this month. There was an awful lot in it. I don't think it's an expectation that everything in it is going to be implemented as a remedy. And I think I want to look at this. There's a lot in it that they're asking the RCVS to do, but I think today we want to look a little bit more at the things they're asking the profession to do. The things that I think clearly are going to come out are around the transparency pieces, around ownership, and being clear about pricing. Now, obviously, being clear about pricing is something we should be doing anyway. it's not about the same as what the price is. It's just about being clear. If something's going to cost X, we need to say so. Whether or not it should cost X is a different conversation. That's in there. There's a lot of push around choice for clients. And I think that's a really difficult one because it's a complex market. It is not about shopping for things. And that value of relationship and continuity and the contextualized care that Sue was talking about, it does get difficult. And I think if we start to fragment things as well, there is actual potential for overall to the client for things to not improve for them just because we're moving things around. So I think there's a lot we need to think about as a profession, but undoubtedly being clear, being confident talking about money, understanding why things cost what they cost. And I think in some of the early stuff going into the CMA, it was clear as a profession, we need to remain connected with the commercial realities of what it costs for us to do our work so that we understand our value and can really communicate that effectively.
Thank you. And we had lots of questions about the role of vet nurses, and we've got the Ambition session that's coming later on this year talking about vet nurses specifically. But are you able just to give a couple of sentences about legislative reform and potential timelines that we might be looking at for this, please?
A lot of crystal ball. There's definitely a crystal ball needed on that one. I think a lot of the things that are mooted as changes without a timescale are because for them to happen, legislative reform is required. So people often say, the college has decided this, but there's no timescale. Well, actually, the college can't decide. The college is making recommendations potentially, but the decision sits with government and legislative reform. And a lot of the things around the role of nurses depends on that as well. And in particular, uncoupling the work of nurses from the exemptions that exist under the current Act. There's been work going on for years around legislative reform, lobbying both the RCVS and many other organisations as well, BVA and other stakeholders. And anything like this is slow. However, DEFRA have now publicly said they are actively engaging in this, and a huge amount of work is going in every week into looking at this. So we think we're closer than we've ever been. However, even with the best case scenario, we are talking by the end of this sort of election cycle. So it's not tomorrow. And it is a maybe. So I think there's an awful lot we should be looking on what we can do differently now under the current legislation from a nursing perspective. And there is quite a lot, rather than always looking at the things that depend on legislative reform.
And Gareth, can I add to that too?
Absolutely.
I think when we get changes in our VSA, because we will get changes, it's just when we actually get them. I would dispute whether those numbers will still stack up, because I don't see how we'll have an oversupply of nurses. Because once we actually start to use nurses to their full potential, because these are driven professionals with who contribute enormously to the veterinary team, I actually think they will start to do jobs that they're more than qualified to do, that they'll be able to do under new legislation. I think they'll be supportive to our vets, and I actually think we'll see a change in the way that practices work. And I don't see we'll have an oversupply of nurses. I think what they'll do is they'll help bolster the veterinary workforce so that actually they help support the vets in practice. So I actually see that's going to be really, really positive. And the sooner we get a change in the VSA, I think it's going to help our workforce absolutely enormously. It will help with retention of nurses who can be rewarded more generously, get better work satisfaction, and I think it starts to support our veterinary workforce in a much better way.
Well, that leads us quite nicely into the next part, Sue. So thinking about that leadership, culture, delegation, all of those different areas, we know that everyday leadership as well as official leadership will set a large tone. So can you share some of the highlights that you've observed from your RCVS work, and hopefully give people a bit of a flavour as to what else is going on that supports that everyday culture?
Yeah, I think people recognise college as being a regulator, and of course college is a regulator. And people seem to think that that's one of the few things that college does. But the true Royal College component of it, working under our charter, there's huge amounts of stuff that's there. And as chair of APC, I've been able to see an awful lot of that. There is so much great stuff on the academy. The academy has really been created to help people comply with their regulatory requirements. So there's all sorts of really great courses around leadership courses, which people can do. And there's courses around difficult conversations with clients and the like. So if you've not had a chance to look at the academy yet, I think it's a really great resource that's there that is actually I think is very underused at the moment. And of course, it's CPD and it's free CPD, and we all like a little bit of free CPD. So certainly, I think it's something that we should look to use in a lot more if we possibly can.
Absolutely. We've also had questions about vet GDP. Are you able to just give a little bit of a flavour of that one as well, please?
Yeah, of course I am. Vet GDP. So that GDP for me has got two aspects to it. One of the component parts of it is the fact it supports our new graduates, and we know that support for new graduates is absolutely essential to help with our retention. And we know without that support, we will lose more of our new grads. What it helps to do is it helps to build their confidence and competence to develop into really great vets. The positive things about it is that whereas the old PDP was not part of code, the vet GDP is part of code. And so what it actually stipulates is there has to be appointed senior veterinary surgeon in the practice to oversee the process. They have to give the graduate and their mentor protected time in order to be able to work through their portfolios and actually gain the confidence that we actually need. The other thing which people perhaps don't know perhaps so much about is the fact that as part of the whole process, we are getting huge amounts of really rich data going back into college. If you look at the sort of surveys that were put out by the vet schools looking at feedback from employers and from new graduates in the past, the return rate of those was sometimes less than 10%. Whereas we're getting data from pretty much every single new graduate and also from every single new graduate's employer, because they have to complete that as part of that GDP. So we're able to look at where the strengths are of the different programs, where potentially there are components of the program that may not be as good. So whether it might be, I don't know, equine diagnostics or something. And that data is fed back to the schools as part of this continual quality improvement that college is now promoting. So the nice thing about it is, there's been previous criticisms that students come out, graduates, and they're not fit for practice, and they've got all these airs and graces because they've been taught in referral practice. It's far from that now, because not only are they being taught in a primary care context, we have this feedback to the schools where they can actually improve their own program. So I think it's great, and we're certainly looking at the very, very early data. It does seem to be making a difference to our retention rates.
Indeed, and a really positive experience for those that take part. We've had some questions in the chat and some discussion looking around working times and chronic illness and those sorts of things. So I might just take this opportunity to flag the chronic illness survey that we undertook. So this was a groundbreaking survey that looked at chronic illness, disability, neurodiversity and mental health, not just within qualified vets and nurses, but also looking at the student population as well. So there's some more information on that on the website, but also the Let's Talk Adjustment campaign that we're currently running. So this is enabling people to think about what reasonable adjustments might support them and help them within their workplace. And we are also just about to launch a vet return course into the academy. So this is to help vets who might not longer be in practice but would like to return. And this is aimed at helping them and their employers. So just a quick plug for that one. So continuing on this theme of culture and how we have that everyday leadership thread running through, if we bring it down to the individual and think about career progression, I don't know how many people here have seen the VCCP or perhaps even know what it stands for. But Sue, might you be able to just give an overview, and then Linda, from your GP perspective, think about the positives that it could bring, please?
Okay. So the veterinary clinical careers pathway, there are three different components to it. One is looking at the creation of a specialist GP, if you can use those two words in the same sentence, a specialist GP qualification. And that's actually a piece of work that's really very advanced, to the point that in Education Committee today, we were looking at the outlines of the curriculum for that. And I think that's really, really exciting. The second work stream is looking at trying to define more clearly the different qualifications, because there's a huge misconception from the professions and also from the public about what an AP is, what a certificate holder is, what a specialist is. And so there's a real need to try and redefine those terms. And it may be we need to change those names to produce greater clarity. And then the third thing, which I'm particularly passionate about, is having flexible routes from primary care practice to do specialist qualifications, because we know that the sacrifices that people have to make through residencies and internships are sacrifices not everybody can do. If you've got a partner who's got a fixed place of work, you've got dependents, whether it's elderly relatives or children, you can't always up sticks and disappear off and do a residency. So we're looking at working with the European boards to look at flexible ways for people to do specialists in clinical subjects, so ophthalmology, dermatology, etc., to actually increase the diversity of our workforce. So three really great stuff, and it all boils back to one of those ambitions around career progression and a sort of rewarding pathway for people. I think at the moment, general practice, people do their APs and then they hit a bit of a brick wall. And I think one of the reasons why potentially people might consider leaving is because they don't feel satisfied. There's more that they want to do, there's more they want to give. And I think our specialist qualification will hopefully help contribute to improve that state of affairs.
Excellent. Thank you for sharing that with us, Sue. Hopefully you've had a moment to take that on board. But Linda, as a GP and somebody who's had a fantastic career as a GP, what might this have meant to you, or what do you think this could mean to those who are newly in GP practice at the moment?
I think you've got to look at it in different ways. There's what it might mean for an individual, my own development, my own sense of reward, and that side of the work. And then there's looking at it from the impact you can then have within practice. And what that impact is, also coming back to your earlier comment, does depend on the workplace culture as to what you can bring in. And certainly, we've seen people, go through, as you say, AP and really bring great differences to not just to their own work, but to the wider piece. But it does require that flexibility within practice. And I think one of the things we're seeing is where there's some inflexibility in practice, and maybe structures are designed not by the people who are going to work in them. And there's a bit of a disconnect there, and that limits people's abilities to bring that through. So I think as well as doing all this work, we've got to think about how it's going to translate into the workplace. And it can bring real benefits across the whole team rather than just for the individual involved. So you look at the CMA stuff, going back to that, and they've got this idea that a FOP, as they call them, a first opinion practice, doesn't do much. They don't seem to understand that veterinary hospitals can be first opinion practices, whether that's a different species. So I think there's a lot we can bring in, but the workplace culture needs to be part of the success of this for where it can go.
Absolutely, and it's something that we will be discussing in more of the ambitions over the next couple of months. So thinking about modern ways of working, as you've referenced there, the flexibility, the different ways in which people might choose to engage within a workplace, and also recognising that lots of people are taking very different career routes. They might be doing clinical work, but that might only be some of their working hours. They might be doing all sorts of different things. So I think it's really interesting to see how this will develop. I'm conscious of the time, and we haven't actually got too much time left. So before I come to the next question for Linda, I'm just going to ask if anybody's got any questions for Linda or Sue or Vicky. Would you mind popping them in the chat while we get to the next question, and then we can come back to them towards the end. So we've had a bit of a run through. Admissions through to curriculum, and then thinking about practice culture. So just some small topics. Moving on to the future. We've had questions come in as part of the pre-submissions about technology, AI, and that's the artificial intelligence AI, not anything else. So Linda, what are your thoughts? Because we had a roundtable last year, and there's been a lot going on in the background. Can you share a bit more about that, please?
There's obviously really different views and feelings around the use of AI in veterinary education and veterinary clinical practice. And there's a real range. I think we've got to think about it that, yes, there are risks, but there are also risks with not using AI as well and not reaping those benefits, arguably, being negligent not to. There's no way we can regulate AI. That ship's definitely sailed. We don't really have the ability to regulate the devices either. It's a global situation, and we don't have the equivalent of the medical situation. But what we can do is regulate how we use AI. And I think we want to look at this from that sword and shield perspective of regulation, so that we can give people the confidence to embrace it and get the benefits whilst mitigating for the risks. And so what we're doing is looking at all sorts of different areas where it's got applications, and many people will be using AI already, possibly even more than they realise they're using it. And there are some areas where it's pretty safe to be working with it. And I think we are looking at still needing a human in the loop and ultimate responsibility sitting there. But where can we provide some assurance? And some of that may well be around a voluntary scheme looking at sort of kite marking of particular devices where we understand the quality of the data that's going in. And remember, it's such a fast-moving field that if you set things up in a very rigid way for today, they'll be irrelevant next month. So lots to think about, but I think as a profession, it's something we should be looking to get the benefits from for animal health and welfare, huge potential. And working with it, but look to some regulation to give us some assurance and support.
Absolutely. So there's just a few small things to tackle there, but there's more information in the report that Tash is going to put into the. In fact, she's already put it into the chat. So if people are interested in learning a bit more about that, then please do take a look. So thinking then about final reflections on leadership before we get to a couple of questions in the chat. Both as your time as leaders so far within your day-to-day clinical work, but also as the RCVS, anything that you're particularly proud of steering or having involvement with, and how might people be able to use any experience that they have to generate a more positive culture? Either of you can go first, whoever's the most enthusiastic.
Don't know about the most enthusiastic, but I'll start. I think one of the things that's really, really valuable is to sometimes step outside of our own profession for our learnings. There are always cross learns, and bringing in wider perspectives is really, really helpful. And this idea that unless it's sort of come from within veterinary, it has no relevance to us, we're missing tricks there. And I think there's enormous value in bringing in some outside perspectives and us stepping outside and learning, not just with our colleagues from practice, but more widely.
Thank you. Sue?
I think they've probably had enough from me already, haven't they? So I suppose the thing that I'm very passionate about is that we reflect the society that we serve, and we are very undiverse as professions. I mean, look at the nursing profession. 97% of the nursing profession is female, and that doesn't mean to say that females don't make fantastic nurses, but we need more. We need a lot more boys to be there. It was really interesting. If you go to a big congress like BSAVA or any other of the big congresses and you look around, there's a lot of females, and they are predominantly white. When we went to the New Scientist exhibition, it was a very much more mixed audience that was there, a real variety of different people from different backgrounds. And it just struck me when we went to the New Scientist exhibition that actually we need to be a lot more diverse. We really do. And so I think the more we can do around widening participation, I would like to think I've played a small part in helping college to produce better career material, which I think is absolutely key, because I think so many of us as parents or involvement with schools, go into schools and do career talks and can give our share our experiences and our enthusiasm for the profession. I think having career resources and stuff that's there is really important. So I think that's probably one of the things that I will value the most when I leave college, which I will do probably in about another 15 months as I come to the end of my 12-year term. I think widening participation for me is absolute key. I think when we have kids entering the profession who are driven and determined and really want to be vets, and some of these have struggled to reach vet school, those are the ones that are going to stay. I when I went to my inauguration speech at Royal College Day, I talked about how I didn't make vet school first time around. I didn't, like a lot of people of my generation, didn't get my physics A level, so I had to stay on another year to get my qualification, and it was because that's what I wanted to do. And so many other people have come up to me who are perhaps been qualified for quite a long period of time have said, do you know, I have exactly the same story. I didn't get in first time and I went back. And I think those are the people who've perhaps had to fight a bit, who are perhaps a little bit more resilient, who perhaps are the ones who've stayed in the profession. And I think when we're getting those people from those sorts of backgrounds, I think they're much more likely to stay because they really, really want to be vets. And those are the ones I think that are going to stay in the career and contribute to the profession. So for me, widening participation has been something that I would hope I've helped drive college and encourage college to do more on.
Thank you, Sue. And I think you are right in terms of thinking about the diversity of the communities that vets and nurses and practices serve. It's important to see that reflected. There is a question that's slightly tangential to that, looking at overseas vet students within universities, and whether we know the percentage of university places offered. I might ask Vicky if you are able to pop in the chat some of the information that we have about that, because we did look at this as part of the workforce model and the assumption of those who don't join the register. But as far as I'm aware, there is no cap, unless, Sue, you can correct me on that, because you've worked closely on this. But is there a cap for universities on how many overseas places they're allowed to offer that you're aware of?
I think the single biggest problem, Anne Garrett, is funding for our schools. And it would be lovely to see that they were funded properly, so they didn't have to rely on foreign students coming in. Not that there's anything wrong with foreign students coming in to contribute to our workforce, but many of them come in because it's a lower cost education than it is perhaps at home, and then many of them will go back afterwards. So the schools admit them really to make ends meet, and so they are subsidising our own homegrown students. And I would suspect that if funding was better, then actually we would be able to provide more places for people to study from the UK, and therefore potentially we might keep more vets in the country.
Interesting, thank you. So we have got one more question that's going up on Slido in just a second. So if you could check that, and then I'll ask Deb to share the results with you on that. We've had quite a few questions that have come through. There's a lot of comments on the cost of living, essentially, and for many people saying that it's not that they want to leave because it's not that they don't want to be a vet and that's why they're leaving. It's more that they are struggling to stay in and keep themselves afloat. So I don't know, Linda, if you have any immediate reflections on those sorts of comments and potentially some support for thinking about people who might want to come back when they're ready.
I think in terms of, it's a bit of a difficult one, isn't it? We've got a situation into one sector of the veterinary market talking about the costs, and there were all sorts of debates about the impact on veterinary wages and how it hadn't been a cause and it had been a cause, and real mixed messaging around that. And, remuneration isn't, it's not a particularly highly paid profession at all. And the structure of the industry is part of that, and maybe something we need to think about. And then there's the bigger societal issue around the costs of working when you have dependents, and the burden of looking after dependents. And we need to be thinking about this not just from a veterinary perspective, but society as well. When is this going to change?
Absolutely, it's a really difficult one, and one that is also being discussed across many other professions and career stages as well. So I would agree with you. It's one that unfortunately we don't have the answer to immediately.
But we should certainly be part of the conversation.
Absolutely. Absolutely. And I think this is one where, with the later ambitions, we can start to explore, especially thinking about ways of working and leadership, how we might be able to enable these conversations to take place so that people can still do something that they love. So we've asked you the question, if you had to name one thing that has kept you or would keep you in this field, so stop you from leaving, what would that be? And what I'm seeing here coming through is that there's a lot of very similar content to the question at the start when we asked you about what do you love. So there's a large sentiment here around animal welfare, love for animals, passion for helping animals, person-centered employers, the people, family. I'm not sure if that's thinking about the wider relationships that you might have with your team and how you might describe that, or whether that's the ability to work with family members, but relationships with colleagues and clients and patients, all the different people, and this is all really important, I think, for us to reflect on and to take a moment to think about why do we all do what we do. But then also, from an everyday leadership perspective, how can we ensure that there is more of this? I don't know, Sue or Linda, if you're seeing this, and if there's anything that particularly resonates with either of you. Is there anything in here that matches as to why you, on those bad days, went, I'm going to stick at it?
I suppose for me, it's making a difference. I suppose, people's pets are part of their families. And I think it's still a pleasure and a privilege to be able to help people when their animals come to you. So for me, and I still get a buzz out of it. I think when I stop getting a buzz out of making something better or helping someone, then that's probably the time when I will pull up sticks and go. But I just think all of us, it's a way of life, I think, for most people. I don't think it's a job. I think it is what we are. It's part of our being as vets and as vet nurses. That's why we do it.
Thank you, Sue. Linda?
I think it's how bad days impact you. I always believe there's good days. Tomorrow's a good day, and that sort of thing is an understanding that not everything is going to be as I'd like it to be in veterinary. It just can't be. There is risk. And I think probably a little bit, one of the things to think about is what is our attitude to risk as a profession? And I think that's an area we could explore, because it might make a lot of things a little more palatable sometimes.
I think that's a really good question for all of us to consider in terms of the risk appetite and how that changes as your career develops, and the different experiences that you have, and your appetite for risk might be very different on some days to the other. So good food for thought there, if I can say that correctly. So a huge thank you to you for sharing your thoughts and your experiences with us. Hopefully, for those of you who've joined us, you've been able to see that there is a huge amount that is going on in the background, and all of the teams across our organisation, whether they are more regulatory in their day job, or whether they're more upstream regulation and Royal College, that there is stuff that's going on every day that's impacting across every different group and community, and we're very proud of all the different initiatives that are coming through. Some are very nascent and we haven't seen their impact yet, and some are growing and developing and have been established for a long time. I mostly also want to say thank you to our delegates for sharing your thoughts and some very personal thoughts and feelings within this chat. It's really great to hear from you and to help us understand a bit more about where you're at right now, and what might need to change, or what might need to be different, but also from the thoughts and feelings that you've shared with the Slido in terms of how we might learn from what does go well, and imbue a bit more of that into the day. So we've covered a lot of ground, and there's more to come. So the purpose of this session, as we said at the beginning, was to think about the workforce in its in its current sort of form, give you some of the data, some of the insight, a little bit of a flavour across the activities. And Sue and Linda have been made to work quite hard, I think, to share all of this with you. But if you're interested in joining us for more sessions, we have got 7 more. So it's not too late to sign up and be part of those. As I said at the beginning, some of the questions that were submitted for this have been allocated to very specific sessions where we've got experts. And they will be answered in those. So make sure you do come and join us for those. This has been recorded, so we will be able to share this hopefully within the next week or so. Once we've made sure that it's all neat and tidy and ready to go out to you. It will be something that's available for everybody to watch. It will go up on the website, and you'll get an email with that link, but also the resources. We are going to share a survey with you as well immediately. I will apologise for this, but I also won't, because we would love to have your feedback. This is a very different type of session to one that we've run previously, so we would welcome your thoughts on this, and what we can learn from this, what type of information or projects that you might be keen to have another similar session on, so that we can learn from that. So there's all of that in there. It will be coming to you. The one question that we were asked, that I'm going to be a bit cheeky here and say that we're not going to answer it just yet, and we're not going to answer it in the next sessions in its entirety. We're going to run it throughout. One of the questions that was submitted was, what do you see as the biggest challenge and potential barrier to achievement of the ambitions? And the person has commented that there's many considerations. The professions are very complex. So this is something that we are going to continue to talk about, because when we talk about the workforce ambitions, and when we engage with different key stakeholder groups, so whether that's species divisions, Vet Schools Council, HE and FE institutions, we're always very conscious that we're all working towards the same goal. We're all trying to make sure that the workforce that we have can be healthy and thriving, and that they can have a positive impact on animal health and welfare, and also on public health. So this question will run its course. So thank you to whoever submitted that. It is a good question. So in terms of the challenges and the barriers, I'd urge everybody to consider how we can all contribute, but also if you spot barriers, think about how we might be able to overcome those hurdles. And I'm going to try not to use too many analogies with hurdle jumping and limbo dancing and all sorts of different things as to how we're going to have to navigate round some of these. So thank you all for joining us. We are 4 minutes before the end, so hopefully you can use that 4 minutes to have a moment not staring at the screen. For those of you who are coming to BVA Live, we will be there, and we'll be running a session there on the Friday afternoon. We've got the last slot, so if you're still standing, and if you're still ready to talk about workforce and practice culture most specifically, then we would love to meet you in person. Come and join us, and if not, we will hopefully see you online at one of these. But thank you again, Vicky, Linda and Sue, for being part of this and feeding us with lots of information. If you do want to get in touch with us, please do. We're always available. The email addresses are in all of the links. So with that, I will let you all go, and hopefully see you all soon. Take care, everyone. Bye bye.